for these allied health professionals to stay current on the latest practices and technological advancement. Consequently, validating one's competency level by earning a professional certification has become a game changer for health professionals seeking to advance their career. In this webinar, we will discuss the latest developments in RPM, IBHRE's newest certification in cardiac device specialist, and what employers look for in allied professionals who monitor cardiac patients. In today's discussion, we'll explore advances in cardiac device remote monitoring, competencies for certified allied professionals who specialize in patient remote monitoring, and the importance of validating your skills in this specialty area. In addition, we'll introduce you to IBHRE's newest credential, the Cardiac Device Remote Monitoring Specialist certification, and discuss what it takes to qualify to sit for the CDRMS exam. We'll also identify the ideal audience for the CDRMS, specifically who should pursue this credential. For those of you who have earned the CCDS, we'll discuss the difference between the CDRMS and CCDS. And finally, we'll also provide you with tips on how to communicate the value of the CDRMS certification to your employer. But first, let's begin with a brief overview of IBHRE and its role in helping allied professionals provide enhanced patient care and heart rhythm management. Since 1985, IBHRE has set the standard for global certification in heart rhythm management and recognizes cardiac care professionals who are skilled in this unique specialty. The Credentialing Board is a self-governing organization that provides competency certification in cardiac rhythm device therapy, cardiac electrophysiology, and cardiac device remote monitoring. Our certification exams are developed and administered to assess the scientific foundation, clinical skills, and the technical knowledge practitioners and industry experts require to provide safe, quality patient care in the management of arrhythmias. More than 10,000 physicians and allied professionals in more than 60 countries around the globe have earned one or more IBHRE credentials. IBHRE credentials include Certified Cardiac Device Specialist, Certified Cardiac Device Specialist, Japan Device Representative, Certified Electrophysiology Specialist, Certified Electrophysiology Specialist Adult, Certified Electrophysiology Specialist Pediatric, and our newest certification, the Cardiac Device Remote Monitoring Specialist, or CDRMS. To earn one of these certifications, candidates must demonstrate that they meet specific criteria to sit for a certification exam. Later in the presentation, Laurie Newmark will discuss the qualifications and criteria to sit for the CDRMS exam. Thank you for joining us today. Our next speakers, Dr. James Allred and Amber Seiler of CV Remote Solutions, will take a look at advances in remote patient monitoring, professional trends in the field, as well as skills and competencies that employers look for in allied health professionals who are certified in this area. And now I'll turn the presentation over to Dr. Allred.
Tracy, thank you so much. And thanks to everyone who have joined this evening. It's really good to have you as part of this discussion. And we're really looking forward to hearing more about the CDRMS exam tonight. I think the timing of this could not be better. When we think about electrophysiology and the advancements that we've had in this space over the past 10 years, I think it's perfect timing for us to look at how we are certifying the folks that are doing remote monitoring for us. And so when we think about how that, technologies such as, sub-Q ICDs and leadless pacemakers and HIS bundle devices have come along, as well as the advances in remote monitoring. 15 years ago, we had TTM and not much more than that. And over time, we've seen tremendous advances in the way that we take care of patients remotely. We've seen guidelines put in place that reflect data that's out there that speaks to remote monitoring and its value. Looking at lots of things like improved patient satisfaction, quality of life, even potentially some mortality benefits with remote monitoring long-term. And so I think this is a great discussion to have tonight, and I'm looking forward to being with each of you tonight as we talk about this. I think back and reflect on my own experience as a fellow in electrophysiology, and what I knew as a fellow was that someone came out of, thin air kind of, with a remote that said that, the patient had a fractured lead or their device was at ERI. And I didn't really give a lot of thought at that point in my career as to how that information got to me. All I knew was that that patient needed to have their lead replaced or they needed to have their generator replaced. And that was my focus. Everything that happened within the electrophysiology lab and the things outside of the lab, at that time in my career just did not seem important. I probably as a fellow referred to those as, kind of a nursing issue or something that was not part of what I would be doing. And once I came into practice, I quickly realized the value of remote monitoring and taking care of patients through a device clinic. Meeting up with a team of nurses, technicians in our clinic. I was new and they were asking me questions, and I quickly realized that they were closer to the answer than I was, and that they had so much more experience with remote patient monitoring than I did. But over the last 15 years, I've really had the opportunity to develop a passion for remote monitoring and have been able to be on various teams and working with folks internationally to look at how to do this better and to improve quality through patient care with cardiac implanted devices. And so I think this exam, the CDRMS exam, is a great transition to the next step to help us all realize the value of remote monitoring and people taking the time to dedicate the training that it needs to be able to take care of these patients well. And so at this time, I want to introduce Amber Seiler. She's a nurse practitioner working with me. And Amber, we've talked a lot about allied professionals being certified and the importance of that. Maybe you could speak a little bit to that tonight.
Yeah, absolutely. And Kathleen put in the chat, if there's questions as we go along, please feel free to leave those there in the chat, and we'll have plenty of time for question and answer at the end of our discussion. So I think as we think about validation of skill sets and why that's important to allied professionals, there's a lot of reasons to take these exams and to be different among your peer group, right? Or to be the same among your peer group if your whole clinic has taken this exam. I think all of us that care for device patients recognize what an awesome responsibility we have and what an honor it is to participate in these patients' care. We are embedded in their lives, and we see these patients year after year, and oftentimes they really do become family. And this role is just incredibly important. It's one that is often under-recognized, and we're going to talk about that today, is how to value some of the, how to communicate the value of these certifications to employers. But I think, in addition to being a huge responsibility, this role is often also very autonomous. Device clinics are often working without direct oversight, side by side with a physician. And so being able to have these certifications where your peer groups, your providers that you work with, and your patients can be very confident that you're providing really high level care is incredibly important. I think we all recognize that in order to become proficient in device care, it takes a lot of time, a lot of training, a lot of independent study, and a lot of dedication to this trade. And it's one that I'm passionate about, and clearly all of you are too, because you've joined this webinar and are interested in this exam. And then once you get proficient with all the things that we have now, then like Dr. Allred said, something brand new comes along, like left bundle pacing and HIS pacing and micra, and we have to figure all that out, right? And so it's a continually evolving field, and one that remains very, very exciting. I think in addition to, just the importance of the device professional being competent and knowing that we're competent because of skill validation, one of the reasons that's incredibly important is because of the complexity of devices now. We have incredible programming options. When I started an EP 18 years ago, I would have never dreamed that we could do the things that we can do now. Things like remote programming are here for some devices. We feel like they will be coming more for other devices. And so being able to navigate that space and feel confident that we're caring for patients really does require, I feel like, this level of certification to be confident, again, not only for you, but your patients and your peer groups. I think also to consider device clinics and remote monitoring, we're being asked now to integrate this device information into patients' lives in ways that we've never been asked to before, right? Patients have more visibility to their data. That's going to continue to evolve. I think more and more of patient care groups are wanting access to this data and wanting to integrate that into the patient care plan. And so as we think about heart failure monitoring or dedicated atrial fibrillation clinics, I think there's a lot of opportunity to take the data that we're receiving from these devices and help other people on the patient's care team recognize the value of that data and help to take better care of patients as we go along. In my mind, certification, whichever one you decide to pursue, it offers validation of a unique skill set that you can provide to your patients. And I think that's incredibly rewarding, both personally and professionally. I also recognize, because I've taken both the device and the EP exam, that these tests aren't easy, right? And so I don't expect this exam to be easy either. It would lose a lot of value if it was. And so again, the fact that you're here and interested in taking this exam just speaks very highly of the commitment that you have to your patients and to your clinics and your communities. So I think now we want to transition just a little bit and talk about how do you communicate that value of certification? I think for us as employers, we recognize the value of certification for people that work with us on our care teams, and we require that certification. We feel like it does put people a little bit above, everyone else in the field, and really just speaks to their commitment, again, to the patient and to this field, to say that they're willing to go the extra mile and take these exams. But we often hear from nurses and other people and technicians and exercise specialists, I really want to get this certification, but my clinic just doesn't seem to recognize why it's important. And so maybe Dr. Allred, as a physician, what do you tell people when they say, I'm having this trouble having this conversation and getting it started? What from a provider standpoint, what's the value in that certification?
So, you've highlighted well the data that's coming out of devices today and how that could be useful. But I think the problem is that this data is overwhelming for clinics. I mean, when you look at devices now transmitting wirelessly and compliance is increasing, and what's coming out of loop recorders, now Bluetooth technology, almost data coming at us real time in some ways, clinics are a little bit overwhelmed with that. And so what is very clear is that it takes people to manage this data. There's a huge opportunity right now, but we need people, and we need the right people. And so I think for device clinics to recognize first that they need, an adequate number of staff to be able to take care of their patients, and to realize what that looks like, but then to be able to retain that staff. And a huge part of staff retention right now, I think, can be, do they have a ladder to climb? I think the self-satisfaction that I see from our team members when they pass this exam is tremendous. I think we all recognize the value that IBHRE stands for. This, as you said, is not an easy test in any way. And so when someone passes this test, it's more than a high five. It's, wow, you've really accomplished something big. And, I remember recently, one of our CV Remote Solutions staff members, she's a nurse, she's been doing this forever, and she's amazing. And she wasn't certified. And we had a conversation, and I said, to really work on our team, we really feel like you should be IBHRE certified. And she said, oh, I've just been so nervous. I've not wanted to take this test for the last, 5 or so years. And I'm like, now's the time, and you're ready, and she was amazing. And I knew that she would do well. And when she passed that test, like the excitement, the enthusiasm, the contentment that she had over that was just so fun to watch and to experience with her. I could see instantly the improvements in her own career, as she had done that. And so I think for some people, it's certainly a personal career ladder move, and that they are able to accomplish something that's tremendous by passing the test. But I also think it's a really good opportunity for employers, because we need to retain staff. You invest in staff, they're trained, your physicians invest in them. What you don't want to do then is lose them. And so how do you retain your staff? Part of it is by providing them opportunities to learn more and to grow, to realize the excitement of passing that test. And then, I really encourage device clinics when I talk to them that I think part of this should be, some improvements in their compensation. A lot of device clinics, I think, are a little bit, their hands are tied a little bit when we're talking about increasing staff pay. And they have matrix within their system, or things that, certain people can only, achieve certain, there's ceilings that people can't seem to rise above. And I've always encouraged, passing this exam is a huge deal. And so I think once you have certification, I think it should allow for some significant improvements in compensation. And we've seen that in a lot of device clinics. And I think that's helped to retain staff. I think it also helps promote staff leadership. People within a device clinic, when they've passed this exam, the people around them recognize their abilities and what they're able to do. And often that, I think, helps them to achieve leadership positions within the device clinic, but also within their program.
Yeah, absolutely. I couldn't agree more. And I think an important piece of communicating this value is also to our patients, right? And being able to say, our team, this is the standard of care, and this is what we expect of our team members, is to have this certification and pass this exam, and celebrate that. If you've got ICD support groups or other ways that you mass communicate with patients, really highlight. I think it's important to share that with everyone. So the patients also recognize, well, I'm getting something really special by coming here and having these folks take care of me.
That's right. And, for our company, that's part of our brand. We feel like when practices with physicians, when they bring CV remote solutions on part of their team, we want them to feel like they're getting the literal best nurses in the country. And we believe that, many of them are IBHRE certified. And so that's important to us. We think quality from certification is a big deal.
Absolutely. So now I think we're going to discuss more specifically about the CDRMS exam. So I'm going to turn this over to Laurie Newmark with HeartWatch Solutions, and she's also chair of the IBHRE's ambassadors. Laurie?
Yes, thank you for that introduction, Amber. So it is my job to introduce you to the newest IBHRE certification, the Cardiac Device Remote Monitoring Specialist, commonly known as CDRMS. This certification examination is designed for individuals who demonstrate that they have the required experience as it applies to cardiac implantable electronic devices with remote monitoring. Experience required to sit for the CDRMS exam may be obtained by performing remote monitoring or in-person evaluations. So this includes exposure to all devices created by major manufacturers, pacemakers, implantable defibrillators, and subcutaneous cardiac rhythm monitoring devices. So who should sit to take this examination? It could be anybody that's on the list. I think the slide is coming up, but it could be a technician, technologist that just wants career advancements like Dr. Allred and Amber talked about, or it could be an advanced nurse practitioner, nurse, physician assistant who supervise remote follow-up and would like to validate their supervision skills by having this examination. So now let's examine the eligibility criteria to sit for this examination. The eligibility criteria include a minimum of an associate degree in a medical field with at least 1 year of CIED remote monitoring or in-person evaluations, or a minimum of 2 years of experience with CIED remote monitoring or in-person evaluation. Or you may have successfully completed the Registered Cardiac Electrophysiology Specialist, the RCES, or the Registered Cardiovascular Invasive Specialist, RCIS examination, and you will require 1 letter of recommendation that validates your competency in the field and commitment to the field. So how did the 2 tests differ? To start, the CCDS is one of the IBHRE's advanced certification examinations. It is designed to assess essential clinical knowledge relevant to supporting the implanting of pacemakers and ICDs, as well as patient follow-up. Candidates who pursue the CCDS credential are expected to have a broad knowledge in 3 general areas: basic science, applied science and technology, clinical practice, diagnosis, interpretation and management of tachyarrhythmias and bradyarrhythmias. On the other hand, CDRMS is more job-specific credential, which validates the competency of practitioners who use remote patient monitoring in caring for their patients. Candidates for this test, the CDRMS test, should have broad knowledge in these general areas: rhythm recognition, device and lead function, remote service management, diagnostic monitoring, and device technology. So now we will look at the blueprints for both examinations. So as I mentioned earlier, the CCDS exam enables candidates to demonstrate deep and broad clinical knowledge relating to the implanting of pacers and ICDs and patient follow-up. So the examination categories are on this slide, but I would point out that applied science and technology counts for 32%, perioperative practice and clinical practice 23%, patient and device follow-up management, which accounts for 27%. So you can see there's a huge category for taking the CCDS exam. It is a 200 multiple choice question examination, and it's administered over a 5-hour time limit. In comparison, the CDRMS exam drills down to focus directly assessing one's competency level relevant to the use and remote monitoring of cardiac devices. So the exam covers rhythm recognition, which is 38%, device and lead function, which is 28%, remote service management accounts for 14%, diagnostic monitoring at 14%, device technology is 6%. This exam is shorter. It consists of 150 questions and is given over a 4-hour time limit. So what is the process for taking the CDRMS exam? The first exam will be held this fall, October 20th, 2021. It's computer-based and will be held at Prometric testing centers around the globe. Completion of the online application is required to determine eligibility and must be submitted by August 5th. You can get more information online. And the Examination fees. As you can see, there's an early bird rate, which is in effect till May 19th. And as you can also see, IBHRE offers a discount on registration for members of Heart Rhythm Society. Well, that concludes my section of the IBHRE's CDRMS certification. I'm now going to turn things back to Tracy Lofty Brown, who will lead us in a discussion.
Thank you, Laurie. Thank you very much for that presentation. And thank you to our other speakers, Dr. James Allred and Amber Seiler, for your insight on device remote monitoring, and to everyone for information regarding IBHRE's new exam. We're going to actually open up for questions and answers. And as mentioned earlier, please post your questions in the chat room. We also are pleased to be joined by Dr. Charles Love, President of IBHRE. And so all of us will be responding to your questions. There is a question that has been posted, and we really would like to get your response, and you can provide your responses in the chat room. But the question is, what is the most important reason that you would consider CDRMS certification? Is it validation of ability? Is it educational value of the process? Is it because it's required by employers? Is it self-assessment? Or is there another reason that you would pursue the CDRMS certification? So just post your responses there, and we'll be reviewing those. Staff will review your comments. But in the meantime, also, please do post any questions that you have. I see that there is a question about practice test of being available and what is going to be required to maintain certification. So right now on the website, there actually is a sample CDRMS item, just so you can have an idea of the cognitive level required for the certification exam. IBHRE also has an online tutorial for its other certifications, and those tutorials can also be used for the CDRMS, and it'll walk you through computer-based testing. It'll show different graphics so you can practice reviewing those as well. So we do have useful information on the website, and for individuals also preparing for the exam, there is the exam content outline posted on the website as well. And we have recommended reading materials, recommended publications posted to the website as well. Okay, so the other question had to do with what is required to maintain certification. And since we do have Dr. Love on here, participating in the meeting, I'm going to turn it over to Dr. Love for that response.
So that's there are two really good questions, that one and another one about the CCDS and CDRMS. And let me answer the second one first. The CCDS exam, which is the more rigorous exam, is a different, more comprehensive credential. If you are a CCDS, we don't recommend taking the CDRMS exam. You will already have that knowledge, or should already have that knowledge. So that knowledge in the CDRMS is incorporated as within the CCDS exam. However, the CDRMS credential will not talk about programming changes very much. It will not talk about patient management very much. It's not going to talk about the kinds of things that the more rigorous examination of CDS does examine. So it's kind of a one-way street. If you are a CCDS, doing remote monitoring will be very second nature to you. You should have that skill set. But if you're a CDRMS, you are not, with that credential, really that credential does not qualify you to do clinic follow-ups and do programming changes and troubleshooting with a programmer and that kind of thing. It's really not designed as that kind of credential, more for the person who is really doing remote monitoring, which right now, I guess there's minimal programming that can be done. You can now change some sensitivities and cutoff rates and things like that, but not the kind of programming troubleshooting that is done otherwise. With regards to recertification, the IBHRE is completely revamping its recertification process to really become a continuous certification process. It used to be once every 10 years, you had to take a high stakes exam. It was not inexpensive. It was time consuming. It was gut wrenching. It was a big barrier to people in order to maintain certification. So the transition is beginning this year. So all new people taking examinations this year will have essentially a 2-year grace period where they don't really have to do anything. And then after that, you become enrolled in what we call the C3 program, which is the continuing certification credentialing process. So it's IBHRE C3, which is rolling out this year. That process will be such that once every 2 years or over a 2-year period of time, you will have the opportunity to review certain papers that we will have links to on the website or be sent to you via the recertification or continuing certification process. You will be able to choose amongst some of these different papers that will be reviews or single topic papers that are really pertinent to the kinds of things one would do. So for example, for the CDRMS exam, we wouldn't talk about how you implant a His bundle pacemaker or something like that. We might talk about, is it capturing, or the difference between selective capture and non-selective capture, things of that nature. But we wouldn't be talking about the finer points about where would the lead be placed or chest x-ray interpretation, things like that. So it would be pertinent to your area. And you would have a palette of different papers to choose from. And then once you read the paper, you would take a knowledge check test. And when you pass that, and you have to pass a certain number of questions over this period of time, and you maintain your credentialing that way. So it's going to be a much easier process. It's going to be open book. You'll be able to take it home using your own computer. So it's going to be a much simpler process. And this C3 process is going to be rolled out for all of our examinations, not just CDRMS.
Okay, so the next question should be for Dr. Allred and Amber. The question is, I am building this service. If you had this choice, how would you set it up, and what qualifications or certifications would you require? Are the old certifications, and they have in parentheses, enough, NASP, enough for a person leading this service?
So I think we could put this into the same perspective. If you were putting together a device clinic, right? Or if you were putting together a remote monitoring company. And I think a big part of that is, just finding the right people who are engaged in learning, furthering their education and growing as electrophysiology team members. And so I don't think there's a right or a wrong answer. And when you're putting this together, I think it's, partnering with really great people who really want to help patients and do the right thing. And things I think will go well from there. I think for CV Remote Solution, for us, just the quality that IBHRE brings, people that have partnered with and taken tests with IBHRE are good people, and they do good things within electrophysiology. And many previously, as she has in her question, NASP certified folks from the past. If you're NASP certified, what that tells me is you have a lot of experience in electrophysiology, right? And so that's someone is probably going to really be great, hopefully, in helping patients and doing the right thing. Amber, do you have anything to add to that?
I don't, but having taken the device exam twice and the EP exam once, I think Dr. Love's description of gut wrenching is absolutely correct. And so if I had my NASP certification and was grandfathered in, I probably would have decided not to unless somebody made me do it. So I think taking into account
I would add that if the Testamer NASP exam is already a very old credential.
Yes.
So, the question is, has that individual maintained their knowledge base? I mean, the difference, as you put, James, earlier, the technology just goes like the wind. And what we were doing with devices and how devices operated 15, 20 years ago is quite a bit different than where we are now. I also like, about this question about how would you set things up, who would you hire? And I've often stated that until recently, it's kind of been the Wild West. I mean, you can get some high school dropout to sit there and copy stuff off the website and format a report and say everything's fine. I mean, you've got no idea who's behind the black curtain, who's operating the bells and whistles behind the curtain. And you really benefit by hiring people or encouraging your people to get certified. And I think as a physician, knowing that the person who is interpreting these tests for me, and when I get one back that says normal or abnormal, knowing that they've got at least some basis of competency in the fact that they've passed an examination. Doesn't make everybody a genius and always right if you pass an exam, but it sure helps you separate the wheat from the chaff a little bit there.
Okay, and there is another question, a follow-up to that, and that is, do you feel that remote monitoring companies will have a preference, CDRMS over CCDS?
I think that's going to be up to the company, and I'll let actually James talk about that as well. I think again the CDRMS is a task-based credential specific to remote monitoring. Certainly, if you have a CCDS, it's a higher credential, so to speak. It's a different credential. It's really meant for a much more comprehensive kind of knowledge base, one that is not particularly needed in the remote monitoring space, but one that, if you have it, great. That's a terrific credential. You've got somebody that's going to most likely be a very high quality candidate. On the other hand, if you've got a CDRMS and they're going to be looking at remotes, that should be equally good for the task at hand.
I agree. For us, we do a fair bit of clinic consultation as well and optimization. We like to take clinics from wherever they are today to wherever they want to get to. And so from that perspective, we really do like CCDS because, as you've said, those are people who have the clinic experience and they have a really well-rounded experience. But absolutely, in the space of remote monitoring, I think this new test will be a great opportunity. And I think there are people today that are trained and they're coming out of training and going straight to remote monitoring, and they don't have the background or the clinical expertise maybe that some others would have. And so I think the new test will be perfect for them because I think they'll do a fine job in helping remotely monitor patients. And I think this test will be important for them. Amber, do you have any thoughts with that?
Yeah, I agree. I think, the companies, I think it'll depend on what their overreaching goals are, right? And so if it's strictly remote monitoring and you're not in a patient's EMR and trying to incorporate that remote data with their clinical data, that's a very different situation than if you're just doing a technical interpretation of a report and sending that on for review and letting the clinic staff, incorporate that into their clinical picture. And so I agree. I think for us, CCDS is clearly, it sends a message, right, that you've got expertise and you can incorporate this data into the patient's clinical picture. But CDRMS is going to be it'll be very sufficient for doing remote monitoring.
And I think the new test is going to be very successful. I think there are a lot of people who are very eager to demonstrate what they've learned and really demonstrate that they're good at it. And I think this test is going to be a really good opportunity for them to do that. So I think it's fantastic.
Thank you. And we do actually already have registrants for the exam. And as mentioned, the deadline to register is August 5th. So we want everyone to take advantage of our early bird deadline. But are there any other questions regarding the certification or even the different roles, positions people may have where they would be interested in getting this certification?
And while people are thinking of those questions or putting them in the chat, I did want to go over our poll question. So we have a poll question in the chat that is, what's the most important reason that you would consider CDRMS certification? And there are lots of answers here. And I think this is really good for Dr. Love and Tracy and the team from IBHRE. I mean, this is a good opportunity to realize, why are people on this WebEx, right? Why do they care? And why would they spend the time to study and learn and do this 5-hour exam? And so I've been looking through the responses And I think they're very good. I see a lot of number 2, which is educational value of the process, and that is real. I've taken a lot of tests over the years, and I study a lot harder if there's a test involved, and try to retain things, right? We all do. And so the educational value, I think, is important. I see lots of folks saying validity of their ability. There are a few that are required by employer, not a lot, but there are some. And then there are self-assessment in there as well. And then other, 1 or 2 of you may have put other. I think I saw 1 other. And, if you wanted to add that other to the chat, you could. But I thank you all for answering that question. I do think, again, it helps the IBHRE team as they think about what they're doing.
And I just want to chime in for one moment and remind people too that we do, one of the jobs of the ambassadors is to mentor people that are taking the test. So we receive emails once, twice a week with people taking the test that need to have a mentor. Maybe they've taken it's their first time, or they didn't pass it the first time. So we can help them. We coach them through the process, talk to them, let them know what kind of materials are out there to help them take the test. So that's available for anybody taking any of the tests also.
Thank you, Laurie, for that reminder. And there is also a candidate handbook posted on the website, and we have an FAQ document and just a wealth of information regarding this exam. But if you ever have a question, you don't see the answer to your question, you can always email IBHRE or even email me directly. All of our contact information is available on the website, ibhre.org. Okay, are there any other questions?
Our goal is to have everybody pass the exam. It is not a curved exam. It's a competency exam, and we have a bar set for what the competency level is. It's not a random 70%. There's a very involved process that goes into standard setting for the examination, and it's theoretically possible for everybody to pass or everybody to fail based on whether or not the group that takes it is competent or not. So there's no curve on this kind of thing. If you meet the standard, you pass. And again, it's a great educational opportunity. We want people to study, learn, and then prove their knowledge base by the examination. And then, then employers are going to be happy to have you. And those of us that consume your services will be more confident that the product that we're buying is a quality product.
So, Dr. Love, how long do you think someone should, at what point are they ready? With CCDS in our clinical practice, we've had really good success with our team members taking that exam and passing. But we've seen a couple of people who didn't pass it the first time. And what I think I realized is that probably they just hadn't been in the game long enough. They just needed another year or two. And I saw that they were a little discouraged by that. I mean, we picked them up and they eventually passed it and did great. But, what's your thought about, especially the new exam? No one really knows a lot about this. And so when would you say someone is ready for that?
So you bring up a great point. I think that the best teacher's experience, as you're suggesting, somebody who just comes out of the pacemaker school or something, or has read a book, they don't have that hands-on experience. And that hands-on experience with the programmers, with the patients, looking at the strips, talking to the reps, talking to the other experienced people in the clinic, working through these problems is the absolute best teacher. Because the CDRMS exam is so task-oriented, it's much more focused. I mean, there's not pharmacology and there's not OR stuff and there's not X-ray interpretation. There's a lot of focus on this examination. So I think it's going to take a little less experience, but one still has to know basics of timing cycles, and rhythm recognition is going to be really, really important. Looking at ECG rhythm strips, 12-lead ECGs, and especially intracardiac EGMs that come out of the devices, being able to look at those, being able to say, oh, this is non-capture, this is noise, this is artifact, this is signal dropout, this is all of those kinds of things that these people are going to see on a daily basis and are going to have to interpret correctly in order to provide good care to the patients. That's what it's going to be all about. So the more experience they have, the better. And that's why we have kind of a minimum criteria to be eligible. We don't want people taking it and failing and becoming discouraged. We want people to get the experience get the knowledge base, and then come in and pass. And it's going to be great for their self-confidence. It's going to be great for the clinic's reputation, and it's going to be great for all of us that participate in this wonderful field of cardiac device therapy.
And I know
I got to run, so I just want to say real quick, thank you, Tracy and James, Amber, and Laurie. Great presentations, and for all of you that are on today and supportive of this project, if you have questions that we didn't get answered today, please email them to us. We're very responsive, happy to answer them. Again, our goal is to have everybody take the exam and do well on it. So good luck to all of you. Thanks for your support of IBHRE.
Thank you, Dr. Love. Okay, so I'm often asked, how are the items, as we refer to them in the testing world, items which are actually questions that encompass the full scope of the question, we call it item, how are items developed? And IBHRE works with subject matter experts and a testing agency, our testing agency, to put the exam together. So there's typically a job task analysis for our certification exams, or what's called a rapid blueprinting exercise, where they're still looking at knowledge, skills, and abilities of the specialist. And then the items are developed in collaboration with the testing agency. Items are also measured and validated. And, all of our certification programs are actually nationally accredited. So there are certain standards that we must meet to maintain our accreditation. So our exams are of the highest quality, and with CDRMS being a new exam, we are still adhering to standards. And I mentioned earlier that if you have any questions, you could email those to IBHRE, but our email address is info, that's INFO, at ibhre.org if you have any questions throughout this process. We also have on the call Dana Reed, and she is our Associate Director, and Dana is the point of contact for the applications. And so if she isn't available, you can also email me directly as well. And all of our information is on the website. Any other questions? Okay, to our speakers, any comments or last minute opinions or thoughts or words of advice for those preparing for the exam?
I've told people often that the CCDS exam was harder than my nursing boards, and I mean that with all sincerity. And so I don't expect this exam to be easy. I would be disappointed if it was, right? And so I just encourage everyone, if you're looking to take these exams, whichever path you choose to take, it's incredibly rewarding to have these certifications. And to put the time and effort into doing it. I think, as a lot of folks said, it was for the educational value to take these tests. And that's real. I learned so much by reading Hayes 4 times, because you have to before you take these exams. So good luck to everyone. And if you ever need thoughts or, just a sounding board for how do I, talk to my employer about this. Dr. Allred mentioned, increase in pay. Sometimes it's a very difficult conversation to have. If you need examples of clinics who do that so that you can give that to your employer and help you with that leverage, either one of us are more than happy to help talk through that with you, because we do think that these certifications have a lot of value and add value to the clinic. It's just administrators often don't recognize that, and it's difficult for them to put that in the context of the rest of their clinical staff. So we're always happy to help talk through that with anybody that would be helpful for.
As I look at the group, there are a ton of really great electrophysiology partners on this, and it's really great. I mean, they're educators, there are industry folks, there are device clinic leaders, there are people who have been doing this a really long time. And my suspicion is that a lot of you are going to go out there and talk to people in your clinic, people that you interact with. And I think being supportive of IBHRE is great. And I'm glad that you're here. I'm glad that you had time tonight. And I look forward to interacting with each of you in the world of electrophysiology in the future. And hopefully we'll all be in Boston in July at Heart Rhythm together. And I hope you'll say hi if we're there at the same time. But thank you all for coming tonight. And I encourage you all to take the test and to help others advance their careers as well.
Okay, and IBHRE will also be at Heart Rhythm 2021 in Boston. So please be sure to look for us. We will be there with having an IBHRE lounge and exhibit. I'll be there, and I look forward to meeting you all there. Thank you very much for a great presentation.
Thank you.
Good night, everyone.
Good night.